The other very important focus of AGITG clinical research is survivorship, and this is becoming more and more important as we have more cancer survivors. It's really research that's to understand or better understand the issues that patients have after their diagnosis of cancer when they become survivors. Not that I love that term, but we want to minimise the long-term complications or the late effects that cancer survivors might experience as a result of their treatments they've had in the past or the cancer itself. So an example of a study that unfortunately we weren't able to participate in is a study called the Challenge study. And this is a study which I think very importantly looks at the impact of physical activity on how long patients live who have had an early stage bowel cancer that has been removed. So after they've had their surgery and they may have had some chemotherapy, they usually then go on to, surveillance, where we see them every 3 to 6 months. They have some blood tests, colonoscopies every few years, and some CAT scans. And we're hoping that they're going to be survivors, but we're looking to see what we can do to improve the outcomes of this group of patients. And we know from lots of observational studies and database studies that exercise is incredibly important in improving outcomes in patients with GI cancer, not just GI cancer, prostate cancer, breast cancer, all sorts of cancers. However, we need a large phase 3 study that actually proves that, so we can take that to the policymakers and the government and say, look, this is what we've found. You need to write policy to make changes so that we have that exercise prescription built in to the treatments for bowel cancer. So this particular study is looking at a structured physical activity program plus provision of just the standard information that our patients get after they've had their bowel cancer removed versus just the standard information that they would get. And they're looking at a number of things regarding things like overall survival, but also the quality of life of patients. And unfortunately, when we really want to do this study, but at that time we didn't have an exercise physiologist to be involved, but maybe next time. So, and I think they're still recruiting, and hopefully they'll have their numbers. They needed, I think, about 1,000 patients to answer that very important question.